How do you know if your hip flexor is tight? Well, there's 3 tests that we can do via telehealth that I'm going to show you today. Make sure to stay around to the last one because it's my favorite. We can use something like active hip range of motion just as we are today here. So what we usually do is I usually have them go like this, but just because the microphone gets muffled, I'm not going to. And see if they can actually drive their hip or their heel long and up the wall behind them. What we're looking for is to see when they have a limitation of range. The person can oftentimes feel how much thigh gets off the ground versus this, right? But we want to give them a cue of long versus up because a lot of times their hamstring will cramp or they'll couple this movement naturally with lumbar extension, which fools us in the test. So long and then slightly up, long and slightly up. And we compare side to side. Some people with conditions like hip flexor ones cannot actually get their thigh up off the ground. So if it's dramatically different, then you may want to get further testing done to confirm your diagnosis. Thomas test, this is for hip flexor contracture, but also identifies other parts of the thigh which can be contributing aspects to groin pain. So what we're going to do is we're going to lay on our back. This can be done on the floor as well, but most of the time it's better on something like a bed. So you start on your back, and I'm going to do this leg as the non-treated or assessed leg, and we're going to bring this guy up to the chest and then hug it nice and tight. What we're looking for is to see if this thigh starts to pop up off the table or if this foot starts to come further away from the table. What this indicates is possibility of tightnesses of psoas muscle or the rectus femoris. We also want to see as well if the lumbar spine starts to extend. It indicates possible hip flexor tightness as well. This test for the hip flexor is called a modified Thomas test. The modified Thomas test, you usually start on the edge of a bed or something like so. We're going to bring this up. Usually there's a provider with them, but remember these are telehealth ones, so these are slightly modified Thomas tests that we tend to do. Because of the length of the bench, I'm going to slide over this way a little bit, and you basically rock back. Keep it tucked as much as you can on the way down, and then you relax everything else. Again, the reason for the provider is because it keeps them in a tucked position on the way down, so you have to dictate that they go pretty slow, and this is too narrow for me to do it. But what we're looking for is 3 things. We're looking for excessive lumbar extension while they're in this position. We're looking for the thigh on the other side to pop up, which is the side that we're actually assessing, or we're looking to see that the foot comes excessively out. It should generally be at 90 degrees, which could mean rectus femoris tightness, which is one of the thigh muscles. Wondering what else can be diagnosed via telehealth? Check out our other exam series that I have in the description below this video. And as always, if you want to work with us, please reach out.